Assalamu alaikum. Today the topic is pancreas. Pancreas is a compound acinar type of gland which have both exocrine and the endocrine parts. First we will discuss the parts of the pancreas. Pancreas have different parts. Firstly there is the head, then body and tail. But we will discuss the pancreas histology just. So, pancreas, like other glands, also covered by a connective tissue capsule. This capsule sends septa, and these septa will divide the pancreas into different lobules. And in these septa, they will run different ducts and the blood vessels. Pancreas has different types of secretions. It secretes some enzymes as well as hormones, as it has two parts, exocrine and endocrine. So first we will discuss the exocrine portion of the pancreas. It has the pear-shaped acini like this. These are the pyramidal shaped acinous cells which have basal basophilia. You can appreciate here, centrally located nucleus, and which is almost towards the basal side, and apical zymogen granules. These are the apical zymogen granules. This is the basal basophilia, basally located nucleus, and beside these structures, these pyramidal cells of the acini have also Golgi complex, Golgi apparatus, as well as mitochondria. Then we have a very typical feature of the exocrine portion. In the acini, you will find out centroacinar cells. Here you will find the centroacinar cells. These cells protrude towards the lumen. These are the centroacinar cells. They project towards the lumen of the acinus, and they secrete some bicarbonate ions to alkaline the secretions which are coming from the stomach. So this is the acinus. Then this acinus becomes continuous with the intercalated duct. This intercalated duct, which is lined by the simple cuboidal epithelium, its initial portion projects into the lumen of the acinus. So just on the side of this acinus, you will find the intercalated duct which has simple cuboidal epithelium. Then there are some secretions of the exocrine gland, which are the amylase, lipase and trypsinogen. Also nucleases are also secreted by the exocrine portion of the pancreas. Amylase, these are the secretions of the exocrine portion. Then we have lipase for the digestion of the lipids. Then we have trypsinogen. And then we have the nucleases. Nucleases are further divided into the DNAs and RNAs. Trypsinogen is secreted in inactive form, but when an enzyme known as the enterokinase, this enzyme comes from the duodenum. This enzyme enterokinase will act on the trypsinogen in the intestine. And then this inactive form or the pro form of the protein enzyme will become active, and it is converted into an active form which is known as trypsin. Now this trypsin in turn will activate a cascade of protein digesting enzymes. In this way, the proteins will be digested. If there is any defect in the exocrine portion of the pancreas, then what will happen? There will be a condition known as acute necrotizing pancreatitis. What will happen in the acute necrotizing pancreatitis? In this, the active form will be present. That is why the pancreas will be digested by its enzymes. This condition is known as acute necrotizing pancreatitis, and it happens mainly in the patients. This was the exocrine portion of the pancreas, in which I told about the pear-shaped acini. Then I told about the acina structure, which are pyramidal shaped cells with basally located nucleus, basal basophilia, and apical zygoid granules, which are mostly present, or their number are increased in the fasted patients, and the centroacinar cells, which project towards the lumen. And we have the intercalated ducts continuous here, and these are lined by the simple cuboidal epithelium. Then I told about the secretion of the exocrine portion, which are amylase, lipase, trypsinogen, and nucleases. In case of the trypsinogen, I told you this is secreted in inactive form. When the enterokinase enzyme is secreted from the duodenum, then it is converted into the trypsin, and it will in turn activate a cascade of enzymes, protein digesting enzymes. Other portion of the pancreas is the endocrine portion. This has the islet of Langerhans, which is a very important feature of the pancreas, islet of Langerhans. These are dispersed among the exocrine portion of the pancreas. So what type of cells you will find in the islet of Langerhans? You will find out alpha cells, beta cells, delta cells, FF, or you can say P cells, and enterochromaffin cells. These are few cells which are secreted in the islet of Langerhans. These are present in the islet of Langerhans. So, in where the alpha cells are present? Alpha cells are present on the peripheral side of the islet of Langerhans. And these alpha cells secrete glucagon. These are somewhat darkly staining. Then we have beta cells. Beta cells are present in the center of the islet of Langerhans. Here are the alpha cells which are present peripherally, and beta cells are present in the center. And what does beta cells do? They secrete an insulin enzyme, which is very, very important. Then we have B cells which are scattered among the alpha and the beta cells, and they secrete somatostatin. Then we have FF4P cells also here, and enterochromaffin cells which release some enzymes or substances, substance P or serotonin, etc. So these were the cells of the islet of Langerhans: alpha cells, beta cells, D cells, FF4P cells, which is known as the pancreatic polypeptide, and the enterochromaffin cells. Then we have the disorders. Which disorders occur if there is any defect in the islet of Langerhans or its cells? Firstly, there is a disorder known as the juvenile or insulin dependent diabetes mellitus or type 1 diabetes mellitus. What does happen in this type of diabetes mellitus? In this type of diabetes mellitus, the insulin production is impaired because of the destruction of the beta cells. When the destruction of beta cells happen, then what will be there? There will be decreased insulin production, or insulin production got impaired. So we have to give the insulin to maintain the glucose level in the body. So it is known as insulin dependent diabetes mellitus. And this is in the youngish, that is why it is known as juvenile type of diabetes mellitus. Second type is the non-insulin dependent or type 2 diabetes mellitus. In this, the insulin production is normal, beta cells are normal, but this is due to the obesity. Due to the obesity, the beta cells become non-responsive, and the pancreas our body become non-responsive to the insulin. That is why this is known as non-insulin dependent diabetes mellitus. So in the endocrine portion, we discuss mainly about the islets of Langerhans, their structure, and these are lighter stained as compared to the acini of the exocrine portion. And we discuss two clinicals, juvenile or insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus. Then we will discuss some differences between the pancreas and the parotid gland. As I told you in my last lecture about some features of the parotid gland, but now we will discuss some differences. First difference is the pancreas has both exocrine and endocrine portions, but this is not in the case of the parotid gland. In case of the pancreas, the striated ducts are absent, but these striated ducts are present in the parotid gland. Then we have islet of Langerhans in case of the pancreas, but these are absent in case of the parotid gland. Then we have centroacinar cells in the pancreas which are absent in the parotid gland. Then we have the initial portion of the intercalated duct which penetrate the lumen of the acini, but this is not the case in case of the parotid gland. Then the difference about the secretions of both glands. In case of the pancreas, the secretions are amylase, lipase, trypsinogen and the nucleases. While in case of the parotid gland, the secretions are amylase and proline-rich proteins. So these are the few 6 differences between the pancreas and the parotid gland. You should keep it in mind because they can be asked. First, the exocrine and the endocrine portion, striated ducts absent, presence of islet of Langerhans, centroacinar cells, initial portion of intercalated duct penetrate lumen of the acini, and about the secretions which are amylase, lipase, trypsinogen and nucleases. I hope you understand the pancreas. Thank you.